Here we are at St Theresa Bilingual International Bilingual Comprehensive College, Buea.
You cannot study well, and even when your teachers are sick, they cannot teach you well. So they are here to talk to us about some health issues, and I want to believe that we are going to listen to them and ask questions in areas we have not understood so that we can be better clarified. And I pray that whatever we have here today, we are going to put it into practice. Because if they have decided to come here and give us a free lecture, it means we are really privileged. And we have to thank God and thank them for such a venture. So with that, I'll hand over to our dear visitors, and they are going to run the show from here. Yes.
Thank you, Mr. Principal.
You're welcome.
Thank you. Dear colleagues, fellow students, I'm a teacher, so I would like us to forget that we have teachers in front of us and open up our ears and our minds, okay?
Yes, sir.
Good. We are here because of a very important thing that you don't always hear about on TV, on radio. What are the diseases that you hear most about on TV, on radio? Yes? Cholera, HIV, AIDS, malaria, and there are many others. How often do you hear about cancer? Not really often, right?
Yes.
The problem with that is, with cancer, is that people are afraid to talk about it. They are ashamed to talk about it because they don't know much about it. You just hear that cancer, oh, when you have cancer, you die. Okay? So that's when you have cancer, if it is detected earlier, it can be treated as doctor will tell us. We are here because we want you to be growing up with the habits that make people live healthy and useful lives. Your principal said it all, that a healthy teacher will be a good
Teacher.
A sick teacher will not teach you well. A sick student cannot learn well. So please, we are here for that purpose, to make you understand that there are certain habits. You know what a habit is? There are certain habits that you should avoid as you are growing up. There are certain things that you should start doing to become what you want to become and avoid having cancer. Because, take for example, malaria, HIV, AIDS, tuberculosis, right? Every year these diseases kill many hundreds of thousands, millions of Cameroonians. But these three diseases, please, these three diseases do not kill as much as cancer. So cancer kills more than these three diseases. So please, we would like you to look to my right. Who is standing there? A lady, right? Good. How can you describe her? Is she young, old?
Young.
Young, tall, good?
Beautiful.
Beautiful, pretty, Stella Ajo. She works with the Buea Provincial Hospital. And I would also like you to listen attentively to her. She's not a teacher, so please don't make noise while she's presenting. If you have any questions after that, the presentation, you will ask, right? So taking down your questions, you will ask. Don't be ashamed to ask any question. So we thank you and pray for your attention. But we would also like you to become like her. One day, who wants to become a medical doctor? Clap for yourself.
You have to listen.
I'm so sorry that I don't talk so loud and I'm a little tired because I slept at work, so you need to be a little bit attentive to following me. So we'll talk about the few cancers which are a little bit common here in Cameroon, because actually there are so many cancers. Cancers can affect any part of the body. And if you want us to attend to the definition for a cancer, we'll say that a cancer is the abnormal growth of cells in the wrong locations in the body. Usually, every part of the body is made up of small constituents that we call cells. Most of you have done biology, if not all of you. So, if at the level of the breast, we have the wrong cells growing there, and these cells usually multiply faster than the normal cells. We'll call it a breast cancer. If those cells are growing fast, and they are the wrong cells found at the level of the lungs, we'll call it a lung cancer. Now, usually, this is the way cells divide. You have normal cell division. They go up to the end. When you have cell damage in the absence of repairs, that's what we call apoptosis. But in cancers, you discover that the division is a little bit faster, it's abnormal, and you have many more cells multiplying at the end of the day, so that you get to the stage of uncontrolled growth. That's when we talk about cancer in different parts of the body. Alright, there are different kinds of cancers. There are what we call benign cancers, which are, I'll call them simple and milder cancers. Then we have what we call malignant cancers. Those are the ones that are the most wicked of the cancers in quotes. Alright, like I said, there are more than 100 different types of cancers, and we name them depending on the organ. That's why you talk about cancers of the colon, cancers of the breast, and like those which are most common here in our environment, you have cervical cancer, that's for women. Every woman has what we call the cervix. The cervix is like the opening into the uterus. So we have cervical cancers which are very common here. We have breast cancers which are also quite common. We have the lung cancers. We have cancers of the prostate. The prostate is a gland in men. So we find prostate cancers in men. And then we have what we call colorectal cancer. It's cancer that affects the intestines, the terminal part of the intestines. Those are the most common cancers in Cameroon. Now, it's important to know that anybody can suffer from a cancer. When we talk about cancers, we have the tendency to link it to very old people. If you look in your head, it's a picture of one old man who has lived life enough and is ready to die, then God inflicts him with a cancer. But unfortunately, cancers are becoming more and more common in young people, and it should be noted that when you detect a cancer early, then you can save a life. Because when it is at the early stage, there is possibility of treatment, and some people can even get healed of the cancer. But when it becomes late stage, which is the case for most of our patients who we see here, due to the low awareness, most people come to the hospital when they have suffered from it for so long and they have not sought medical attention. So it is now terminal stage, and the only thing we can do is to accompany them to death, like we call it, because you just manage their symptoms. If the cancer causes pains, you manage the pains. It's a bone cancer that leads to many fractures. You treat the fractures, but the patient stays with the cancer because it is already too late to manage it. And treating cancers is equally very expensive for the means that we have around for now. We have chemotherapy, we have radiotherapy, we use x-rays to treat it. And those are very expensive. Not only very expensive, but it's not something that you see everywhere and every day. Most of the cancer treatment centers are found in Yaoundé and Douala. It poses a problem for those around here. Because around here, I've noticed that the experience around here is that when you refer a patient to somewhere else, it's like, oh, my case is finished, I'm dead. But it's just because we don't have a lot of those specialized centers. But remember, prevention is better than cure. There are many ways in which you can prevent these cancers, and you will not be faced with the problem of cost for the treatment. Also, cancers inflict patients with very bad symptoms, like a lot of pains. When you see a cancer patient suffering from pain, then you will know that it is important to prevent cancer. The best means to stop the cancer then is not to go from the treatment, because like I said, most of those who will receive, it's already too late. But then you can go from the prevention, the little measures that you can take for yourself, the little measures that you can use to advise those around you, your family, your friends, your neighbors, and will reduce the rate of cancers around us. We talked about the most frequent cancers, and so we'll move on to cervical cancers. The World Awareness Month for cervical cancers, that's the month when the WHO has set aside to sensitize people most on cervical cancers, is January. And cervical cancer is abnormal growth of cells around the cervix. Like I said, the entrance into the uterus. The uterus is where the woman carries the baby. Okay, this is the cervix. That's a normal cervix. It's there, round, with a small hole in the middle. You will be amazed how much that can expand, because that is the small route through which a baby will pass during delivery. And this is a cervix that is affected by breast cancer, by cervical cancer. These are the different stages. These are the different stages of cervical cancer. So you can move from the normal cervix, it's free there. If you go here, you see what we've written there, early stage 1B cancer of the cervix. There are some abnormal cells which just start there at the end point of the cervix. Then these cells start spreading with time. They spread up even into the uterus, and depending on how much they have spread, those are the different stages of cancers. And the more they spread, the more the risk of metastasis. That is, these cells can move through blood to be deposited in other parts of the body. And when it happens like that, it becomes more complicated. The treatment is even more difficult. This is what we call female genital warts. These are viral infections. Which you find, please, your attention.
Please, shut your mouth and follow the lectures, man.
These are female genital warts. They are caused by a virus just like HIV, but we call it HPV, human papilloma virus. It is sexually transmitted just like HIV, and it is just as wicked as HIV, because these are free cervical cancer lesions. When you have this kind of infection, you are more exposed to have cervical cancer. Alright, what are the symptoms of cervical cancer? Sometimes it could just be asymptomatic, meaning that you have it and you don't have the symptoms. But any abnormal sensation or any abnormality of your menstrual period for those who have started menstruating should make you suspect it, or at least should tell you that there is something wrong. You need to seek medical attention. From then they'll tell you what it is. You could have abnormal vaginal bleeding. Every woman of reproductive age bleeds once in a month, and usually you have the number of days for which you bleed. They vary from person to person, and they are very different. Some people bleed only for 2 days a month, others for 3. Some people can go up to 5. So you must know your cycle, and so that when you have abnormal vaginal bleeding, you will know that there is a problem. If you have bleeding between your regular menstrual periods, like if every month you bleed, if I bled today, I know when I'm expecting my next period next month. If in between you start bleeding, it should tell you that there might be a problem, so you need to seek attention. If you bleed after sexual intercourse or during sexual intercourse, for those who are married and are authorized to have sexual intercourse, then there might be a problem. It might be a symptom of cancer. If your menstrual periods are longer than usual or they are heavier than usual, for example, if you usually bleed for 3 days every month, and next month you bleed for 6 days, then there should be an indication to you that there is a problem. If you usually change 2 pads a day, and next month you have to change 4 or 5, then it should tell you that there is a problem. If you have pains around the pelvic region, like lower abdominal pains, there could be a problem. If you bleed after menopause, it doesn't concern you students so much, but you might have teachers or parents who are menopause. Menopause means that you have stopped bleeding for at least 1 year after the age of about averagely 45 years of age. So if you bleed after menopause, then it's a problem. That's usually the most common symptom of cervical cancers in menopausal women. If you have increased vaginal discharge, there is a problem. Usually in females, you have some small discharge that will come out from time to time, just a little bit, which does not have a bad odor which is white in color. But if you have a change in color of your vaginal discharge, or you have heavy vaginal discharge, it could be a sign of cancer. And like we said, all the symptoms are not specific because they could be just the sign of one or the other infection. But since cancers are that dangerous, it will be good to rule out the possibility of a cancer. Now, what do you do when you find those symptoms? Just visit a doctor. If it's an infection, okay, it's going to be managed as an infection. But if it's a cancer, then we'll need to take it up to the next level with a lot of tests to do the screening and then possibly the treatment, depending on what stage the cancer is. For prevention of cervical cancers, we'll go by vaccines. We showed you the warts, which are caused by the HPV virus. Luckily, there are vaccines that go for HPV, which are not very popular anyway. You have Gardasil and celeBritys4africA, which are advised to be taken by usually and more often non-sexually active young girls who are exposed to this vaccine. So if you have Gardasil and celeBritys4africA, at least you are protected from HPV infections, and consequently, you are protected from some type of cervical cancer. Also, smoking is a risk factor for most cancers of the body, including cancer of the cervix. There are women who smoke. So avoiding smoking is also a means of preventing it. Also, if you do good exercise, even if it's just walking along, like 30 to 45 minutes a day for 3 to 4 times a week, that is good enough to keep you quite healthy, and it's included in cancer prevention. Now, if you also eat a lot of fruits and vegetables which contain the above mentioned vitamins, you are helping yourself stay away from cervical cancer. Also, we advise on screening for girls who are already at an age within the reproductive frame of age and are sexually active. It is good to do a screening like immediately after the first sexual exposure. It is good to get the girl screened for cervical cancer. We have what we call the pap smear. You go to the hospital, they take a smear from around your cervix, look at the cells to see if there are any abnormal cells which are indicative of a cancer. After that, your doctor will give you an indication of when to come for repeat exams. It could be once every year. After that, once every 3 years, once every 5 years, once every 10 years. Then after some time, they can tell you that you are free from the cancer margin. All right. Okay.
Can I say something? Okay, listen please. Doctor has told you about cervical cancer, and she has said that it concerns women exclusively. And you are girls today, you'll be a woman tomorrow. Cervical cancer, most of the time, there is a virus that she showed you here, human papilloma virus, that is sexually transmissible. You transmit it through having sexual relationships. I would like you, young girls, to understand something about sexual relationship. It is not in the Bible. It is said that a man should marry before, or a woman should marry before having sexual relationship. Let me take an example. This is Dr. Ajong. She's 25. Getting to, or just 26, right? It means that she went to primary school for 7 years, secondary school for 7 years. That's 14 years of her life. 14 minus 26, or 26 minus 14 is how many? 12 years. She spent 7 years in QS, the medical school. That's 12 minus 7 is how many? 5. Between then, after her advanced levels, she had to go to university, and after that, she has been out of QS for 2 years. It means that you look at her life, there is a plan. Imagine that she started having sexual relationships the way you know quarter business now. People in the quarter, you see a girl of 14, she's already pregnant. 15, she's pregnant. 13, she's pregnant. No, please, this is very important for you girls. Could she, those boys talking there, Please. Could she have been a medical doctor at 24 if she was sexually active at that time? That is the question. Please, you will have friends who will tell you that no, this is this. You will have boys who will come to you and talk to you, right? And tell you that you, like this, you are silver, you are gold. Please remind them that to be silver, it means that you will have to become what you want to be. And that this is not part of that plan. That this boy who is talking to you, that brother, you are not part of that plan. The plan is for me to finish this thing. Then when I would have been what I want to become, I will have time for it. Please, it's important because sex amongst young people, especially girls, destroys their lives forever. 1, you get STDs, sexually transmitted diseases. 2, you get pregnancies. And one of them died in hospital of recent because they went to some funny man to do an abortion. It's very important. 3, you don't have time to concentrate when you have a boyfriend. You understand? He has 5 different girlfriends and you discover and you are angry. You don't have time to concentrate. Please, it's very important so that as you are growing up, know that you have a plan for your life. And my plan for my life has been to be here. Her plan for her life has been to be a medical doctor. So please, please, please don't start. Who will start? Okay, nobody, right? So don't start, because once you start, it is always difficult for you to go away, to go back. So forget about it, have your plan, and you will see that at the age of 24, 25, you will be a better person, and your parents will be prouder of you than if you brought them a child at the age of 15.
Alright, we'll move on to breast cancer. If you have questions, breast cancer means that abnormal cells are found at the level of the breast. They are multiplying faster than the usual cells. That's the breast what
Good morning, everybody. Now, in the course of this discussion, understand that I'm going to be here till it finishes. You cannot prevent them from continuing the lecture because it is very important. When you laugh, make sure it's for a very short moment. I'm standing behind them watching. Is that clear for everybody?
Yes, sir. Okay, thank you. That's a breast. Your breast can get to this level when you get a cancer. But what happens is that this breast did not develop to this stage in one day. This is like terminal stage breast cancer. It starts by small symptoms. It starts by small signs, which if you neglect can go to this stage. Alright, so how do you know that you have a breast cancer or maybe you're developing one? If you feel any abnormality at the level of your breast or at the level of your nipple, it's important to get examined. And I'll emphasize once again on the age, because breast cancer, these are one of the cancers that we have noticed that are found more and more in young girls, even though it used to be a disease of the old. As early as 18 years of age and even below for some patients, we have found breast cancers. If you feel pains around your nipple, or if you feel a lump around inside your breast, palpate that you feel a mass, then it could be a sign of a breast cancer. If there is any change, what we advise is that every young girl, every woman should be able to examine her breast at least once every month. If you do that, you'll be able to know how your breast is usually, so that when the least change occurs, like the size, like the skin color, like any abnormal feeling, you'll be able to know that in time. And if you know in time, like we said, stitch in time saves time, we'll be able to help you get there. Between 18 and 19 years of age, we advise that you have a breast exam by a clinician, that's a medical doctor, at least once in a year. But as early as 18 years and before, like I said, you can practice on examining your breast yourself. We are going to show you how to examine your breast. By the age of 38, we advise that every woman should have at least a mammogram for future reference. A mammogram is an X-ray that is used to study just the breast, specific to the breast. Between 40 and 49 years, it's advised, especially for people who have a family history of breast cancers. If you have a first-degree relative like a mother, a sister, a grandmother who has had breast cancer before, it's advisable that you have a mammogram once every year, depending on your previous findings. And if you are greater than 50, every year or every other year, it's good to have the mammogram and again perform your regular breast exam. Okay, and so this is how to examine your breast. You take one of these positions. Either you stand at attention like this, or you have your two hands raised, or you put one of your arms behind your head. The other hand you will use it to examine. Or you lie down like she is. You put a pillow below your shoulder, and then one of your arms is behind your head. Now, to examine the breast, first of all, when you stand like this, you can stand before a mirror. That way you have a mirror image of both of your breasts. Do they look alike? Color-wise, size-wise? Then after that, you pass on to the most important one, which is what we call palpation. Palpation just means you're touching your breast to feel it. Now you divide your breast into 4 different parts when you are taking one of these positions. So you can start from this direction. When you divide, you draw a line in the middle and sideways. You start here, you start here, 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 then you come to where you started. What are you looking for? You want to feel if there is a mass inside. Is there a lump? Something inside there. You want to feel if you have pains. And at the end of that, you press your breast as if you want to bring out milk from it, from below, coming up right to the tip. If you're going to find a secretion, usually you shouldn't find secretions coming from your breast. But if you find a secretion, and especially one which has blood coloring it, then it could be an indication of breast cancer. Yeah, right from 18 years and below, like we said, it's good to examine yourself every now and then. Okay, how do you prevent your breast cancer? It's the same thing, like we said. It's good to be aware that there is something like breast cancer, and then you can get it at any age. If you have a family history of breast cancer, it's good to go for screening regularly in the hospital. Eat healthy. Avoid a lot of fats in your food. Eat more vegetables and fruits. Do a lot of exercise. That will help to prevent cancer. Yeah, that's just to say that men are not left out. Hey, we have breast cancer even in men. So it's possible for a man to have a breast cancer. Before you get to this stage, like I said, it doesn't start in the nails. You also start bleeding abnormalities at the level of your breast. You could have a painless lump. You could have changes in skin color. You could have discharge coming from the liquid. So men, you can also have breast cancer.
Please.
Then we're going to move to prostate cancer. The prostate is the gland.
Please, the attention. Okay, go ahead.
The prostate is the gland that is found in the male reproductive organ. This is the bladder here. This is the prostate right below here. It has different parts depending on where it's enveloped by the other parts like the uterus. So you can have cancer of the prostate in men. Usually it's found in older men. So young boys, it might not concern you directly now, but we want you to grow with the awareness that there is something like prostate cancer. And it is quite common in Cameroon. 1 in 3 Cameroonian men above 55 years suffer from prostate cancer. And prostate cancer, just like the other cancers, usually you might not experience any symptoms. You are just staying there and the cancer is growing. So if you don't go for regular checkup after a certain age, you might discover it very late. Most often we discover it during routine exams, like a patient who comes complaining with some urinary symptoms. somebody who needs to urinate frequently. You go to urinate now, just a little comes out. You feel relieved. But by the time you go back to sit down, you feel like urinating again. You go back and just a little comes out. It's called frequency. Then if you have difficulty starting urination, like some people actually need to push to bear down in order to make urine. Those could be symptoms of prostate cancer. If you have painful urination, like some people who are urinating, they feel a burning sensation around the head of the penis where the urine is coming out. That is a sign of cancer. And if you have difficulty having an erection for men who are already sexually active, that could be a symptom of prostate cancer. If you have painful ejaculation, if you find blood in your urine or in your semen, it could be a sign of prostate cancer. Or if you also have frequent pain around your lower back, around your hips, or around your thighs, it could also be signs of prostate cancer. All these symptoms, it should be noted that they are non-specific, because if you have the symptoms just for urinary tract infection, you could have the symptoms for what we call BPH, benign prostate hypertrophy. That is an enlargement of the prostate, but which is not cancer-linked. But it is good nonetheless to rule out the possibility of a cancer, especially after a particular age. From 37 years of age, it is good to have a regular check. Go to the hospital if you are a man above, from 35 and above. Go to the hospital, they'll do you a rectal exam regularly. If your prostate is enlarged, they'll be able to tell. Then they can ask you to do what they call a PSA, prostate-specific antigen, which is a marker for prostate cancers. How do you do to prevent prostate cancers? Eat few calories. That means that reduce the amount of fat and lipids that you have in your food. Reduce the amount of carbohydrates that you eat in your food. Now, we ask you to also watch your calcium intake. We have noticed that here in Africa, we like to take, especially the people who are a little older, they take calcium like systematically. But like I usually tell my patients, no drug is like groundnuts. So there is no drug that you take into your system that does not have a side effect. Don't take drugs when you don't need them. If you want to take calcium, be sure that you have a calcium deficiency, because all of those ions are found in your food. They're found in milk, they're found in what you consume every day. So usually what you take should be able to give you enough. But sometimes when you come and you feel that your symptoms are linked to a decrease in these ions, we send you to the lab, and if they are low, then we ask you to take them. On the contrary, most patients here who have arthritis, anybody who feels like he has a bone disease takes calcium. Hypocalcemia is not the only cause of joint pain, so avoid taking calcium just all the time, because it can also expose you to cancer. Eat more fish, because there is a fat that is found in fish. They call it omega-3. It's a very good fat, and it is used to protect against cancer. There will be some tablets that are commercialized, omega-3, but then you can get that from fish, so why not eat from what you have? Avoid a lot of fatty acids that are found in margarine. Eat a lot of tomatoes. Take a lot of vegetables in your food. Take a lot of fruit. Avoid smoking, because smoking is also a risk factor for prostate cancer. And avoid also taking a lot of multivitamins, mega vitamins. Sometimes there's a lot of this over-the-counter use of vitamins. I don't have appetite, so I take vitamins. I feel a little weak, I take vitamins. But all of those things, like I said, they are found in your fruits, they are found in your vegetables. So if you consume a lot of those naturally, you won't need to run a lot to this synthetic things, which can expose you to more problems than you had before. Relax and enjoy life, stay away from stress. It will help you live long. Remember, all men aged 40 years, this is a take-home message from your parents, students. All men who are aged above 37 to 40 years should go for yearly exams, PSA. And they can go even more regularly just to see a doctor to do them a rectal exam to tell them your prostate is still looking normal inside. Alright, then we move to lung cancers, which is a uncontrolled growth of cells at the level of the lungs. If I should tell you one thing about lung cancers today, I will tell you that stay away from smoking. Because over 90% of lung cancers are a result of smoking. Active smoking, because there is active smoking and there is passive smoking. So 90% of lung cancers come from active smoking of any kind. It could be cigarettes, it could be the pipe that you find most commonly in the villages, it could be cigarettes. But then there is also passive smoking. So you should be able to know what you don't want when you don't want it. If you are somewhere in a closed environment where somebody is smoking, you should be able to take responsibility enough to say, I don't smoke. I don't want a disease from another person who is smoking. For example, when I enter a taxi, I don't have a car, but at least I have my money to take a taxi. If I enter a taxi and the driver is smoking, I tell him, please, I don't tolerate cigarette smoke. Can you drop your cigarette? If he doesn't drop it, I drop. I take another taxi. Don't get diseases from other people. You might not smoke, but like I said, you can inhale tobacco smoke, or your friends. There is a lot of this peer pressure. You don't smoke, you don't like smoking, but you have friends who are always smoking. Come on, you can decide to leave those friends and get to another setting, because that will bring you a lot more problems than that friendship is offering. Also, there is familial predisposition. Lung cancers flow in the bloodline. So if you have a history of lung cancer in your family, you need to be extra aware. If you have other diseases, there are other diseases that predispose you to lung cancer. You have histoplasmosis and other infections of the lungs which should predispose you to lung cancer. And then air pollution. This is most common in industrial zones, where it's not very industrial. If you are used to Buea in particular, and maybe Yaoundé, there are a lot of these companies which burn and send a lot of hazardous smoke into the air. That is not very good to inhale. It predisposes to lung cancer. And it's good to remember that these are the ways of preventing lung cancer. Like we said, smoking cessation for the most part. Stop smoking, eat healthy, do your regular exercise, maintain a healthy weight. Because obesity will predispose you to these cancers as well. For women who have children, breastfeed your kids, and abstain from a lot of sexual relationships, stay in a monogamous relationship, avoid alcohol as much as possible. A minimal consumption we can accept, but when you start taking a lot of alcohol, you are also at risk of cancer. It's important maybe to tell you how important it is to stop smoking as a means of preventing cancer. Studies have shown that the more you smoke, the more you are exposed to lung cancer. The longer the period of time you smoke, the more you are exposed to lung cancer. And when you stop smoking, your risk for developing lung cancer decreases with the number of years. So much so that by 15 years after your last cigarette smoke exposure, you have zero risk of lung cancer. You are just like somebody who has never smoked before. So stay away from smoking as much as possible. Don't smoke away your life. When you stay away from smoking, you stay healthy. Alright, thank you so much for your kind attention. Always remember that prevention is better than cure. You don't need to get cancer to go through the painful experience, to go through the costly experience, to register so many deaths in your family. You can prevent it by the small measures that we have told you, and you will live a healthy and longer life. God bless you.
So, any questions, please? You ask doctor before we leave. Good. It means, please, it means you have understood. All of you sitting in this classroom today should listen to what I have to say in the next 2 minutes. I have a plan for my life. Can you repeat it?
I have a plan for my life.
Cigarette is not part of that plan.
Cigarette is not part of that plan.
Alcohol is not part of that plan.
Alcohol is not part of that plan.
Sexual intercourse is not part of that plan.
Sexual intercourse is not part of that plan.
Because my plan will take me to where I want to be.
Because my plan will take me to where I want to be.
These things that we have just said, please, you might look at it and start laughing. Who is talking out there? As a teacher, I get so irritated when you people are talking and tomorrow or 1 year after, what we are saying here, there's a young man talking out there. What we are saying here, 1 year after, we'll come to the prison and see you there as a prisoner. Young people, you go to prison, you will see those in prison today, and you are ashamed. There are students in school. Yesterday in Kumba, one child carried acid and threw in the friend's eyes. It hurts. And it is because you behave today as if there's nothing, you are a Rambo, you are a Lil Wayne, or whatever you call yourselves. The girls especially, please, let me explain something to you. At the level of this street from here to up Moliko, you count the number of call boxes there, right? With women, the women who do those things, I am not insulting them. It is a few facts. That when they were in secondary schools, their parents used to spend time to have pains trying to look for money to pay their fees. Then they went somewhere and started having sexual relationships with boys, and at the age of 16, 17, they started giving birth to children. Look at those call boxes. Is that the plan for your life? To end up working in a call box, being a smoke farmer, working in a hotel or in a bar, and they give you 15,000 francs. Is that the plan for your life? Please, as we have been saying here, having any sexual relationship is a problem for girls. And try, as doctor said, to avoid it by running away from even those your friends who tell you that no, somebody is promising to give you, but to give us roasted fish. Can you not live without roasted fish? Good. The next thing, please, boys. Doctor said it here. Lung cancer, liver cancer. These two cancers are caused by cigarette smoking and alcohol. Please, part of what we are doing here is to tell you what we have lived through. 26 years ago, I was in Form 3. I was like, how old are you? 12. I was a little bit 1 year older than this man. And what happened? My friends used to come and take my money, and I'll give it back to you tomorrow. And they never give it back to me. One evening, I asked them, this is a cigarette that you are smoking. What is inside? They said, take and try. Listen attentively. That's how 99% of boys who smoke start smoking, and they will smoke all their life. It is very important. I took the cigarette and tried. They said, no, put it like this. I mean, inhale the smoke. I put it and inhaled the smoke. And I started coughing. They laughed. They said, Master, look at me. Then they didn't cough. You will just try again. And I tried again. And please, let me be very frank to you. I have been ashamed of myself for 26 years. Because that decision that I took there has been affecting me. And how do cigarettes affect you? The people who produce cigarettes know that if they produce cigarettes that you will smoke and not come back and buy, will they still be producing it? They go into laboratories and take chemicals. You know what chemicals are? Things that you don't see, and put into that tobacco. And those chemicals create addiction. That if you smoke one cigarette now, you would like to smoke another one now again. You understand? And that is how you smoke all the life. It hurts the people around you. It hurts your finances. It does so much damage. If you live here, boys, girls, you go up towards Monaco in the evening, all the bars are full, right? Those boys started drinking just through group like this. If 4 of you or 5 are friends, and one comes in with a cigarette, please send him away. It's very important. It has come to damage your group. You will start stealing money from the house to buy cigarettes, stealing money to buy alcohol. It gives cigarettes give nothing to somebody. Alcohol gives nothing except brings problems. So please, your plan for your life should be what you have as a vision. And please, cancer is related to habits. If you have good habits, will you have cancer? If you have good habits, you eat well, you exercise, you avoid cigarettes, you avoid alcohol, you avoid premature sex, you will not have this problem. And that's why we came. I have a t-shirt for the person who answered this question before we leave. What causes cervical cancer most? What causes cervical cancer most? Who? Yes? The lady behind. What's her name? Volume. Chumba Princess. Yeah, our princess today. Yes, tell us what causes it. Good. Sexual intercourse. Clap for her. What is the virus? How do they call the virus? Yeah.
The human papilloma virus.
The human papilloma virus. Clap for the two. And both of you come out, please. In St Theresa College. I want you to remember one thing. That 10 years from now we will still be alive. Huh? And you are not supposed to still be in secondary school. You are not supposed to be in a call box, right? You will become what? She will become a lawyer. Clap for her. Now, next one will want to become what? Journalist. Clap for it. Please, these brochures cost money. We spend money to produce them. They are not for you to throw. Go back home, give them to your brothers, your sisters, your parents especially, and tell them to read them, and also try to explain what they have to do. Okay? So bye-bye, and let's just have a group picture outside and then we'll celebrate. So we'll come back.
Because you shift this way, it's too long. Come closer. Come closer. Is that it's too white? What's your name?
My name is
Mary. Your name is
George.
And what is your opinion about what we did today?
It is good and it helps us to encourage us how to keep ourselves healthy from cancer.
And what will you do after this?
I will try to do to practice how to prevent the infection of cancer.
Okay, that's good. Thank you.
If you don't meet tomorrow, then we'll eventually come back.
Mr.
Let's just
Principal,
get
please
the
let
picture.
me interview you for 1 second.
This is a mystery.
Yes. So you just tell me your name and you just give me an impression.
I am Mwanki Abinimonfu. I would like to say that the little talk we have just received today is a God-sent talk, because to me, I believe that as students and as teachers, we need to be very healthy to be able to produce good results, because when we are not healthy, we cannot really study and we cannot really teach our students. So we are very grateful to have this talk today on cancer. And cancer is a deadly disease which most people don't yet know. And when we start educating our children at this young stage, I think it's going to help in the future, because when they have gotten to a stage where they could become victims of cancer, they will know how to prevent this. And we want to say that our doors are always open for such talks, because as professionals, people know better what to advise us on, and with that advice, I think that we are going to have a better health situation too.
Thank you very much, Mr. Principal. I'm very happy. I wish you the best.
Thank
Okay. Bye bye. See you guys. Bye. Please send these other things behind. Rona.